So the two of you are out there on the front lines serving our community as young people, and that's got to be a really powerful, sometimes overwhelming feeling. And what does it feel like for you as students to step forward and serve our community so that those that are more vulnerable can step back and be safe? How does that affect you?
Well, today we're doing more of a like administration kind of thing. We're helping people get checked in so they can get their swabs done. We've helped out in the past in different positions here. We're assisting with taking the swab samples and then they're being sent to labs. But we are kind of just helping people who need the peace of mind in trying to get these swabs done, because it's scary having to come here and seeing all of us gowned up and gloved up. But it's been great. And as students, we're learning a lot that we wouldn't have learned otherwise.
So you use the word scary, and rightly so. I think there's a lot of fear and uncertainty during this pandemic. But what have you learned out there on the swab line? What have you encountered? What has it been like for you to be on the front lines, literally in this response? What it's not like for you?
I think we've learned so much about proper use of personal protective equipment. And this has also been really amazing to see such a dynamic, impactful situation and how it's managed on so many levels. In our textbook, we read about large events like this, but they don't happen that often. So it's a scary and troubling and challenging time, but there's also so much to be learned through these experiences.
So I really appreciate everything that the two of you are doing. As you can see, I'm working from home. And I think that as many people are in the country and in our community right now, we greatly appreciate those who are serving really on the front lines. And you've described how you're doing what you do, but describe for us, how does it feel? What kind of folks are you encountering there on the swab line, and how do you feel in being able to serve them?
It feels really kind of empowering just to know that we are able to use the skills that we've learned in like a practical environment, and especially one that's not been seen at all before and hopefully won't be seen again for a very long time. But we've seen a lot of different people come through. A lot of the ones that I've seen personally have been healthcare providers that are trying to return to work so they can assist more people. So it's been quite a learning experience, and I've learned a lot of things from other students, fellow students, the health department, the nurses that are working out here, and it's been very interesting and rewarding.
Yeah, I think rewarding is a really great word for that. And this is a strange time, and being able to contribute in some small way to support all the healthcare workers that are going through this all day, every day, and working so hard, it feels good to be able to contribute.
Pam, I know that many people, rightly so, are fearful during this global pandemic. But really from day one, I think your faculty and your students have been anything but fearful. In fact, they've been working and volunteering and doing all kinds of things, including working at the call center and the testing center. Describe what it's like for you to be associated with these young people that are really stepping up in a very unique way to serve Mesa County.
Well, David, let me first say, because I'm losing it, how proud I am of you girls of what you're doing out there. You are making an impression on other people in the programs, the community, and I'm very proud of you for doing this. As far as the fear factor, it's definitely fearful. Even healthcare providers are afraid when they go to work. They don't know what they're going to face each day. So we tackled it from the other side. The students wanted to help. This is their community project that they set forth. All the programs are working together in this. And we decided that we have a large number of people. So the EMT program is large. We have a lot of resources. So we contacted the health department and other agencies and said, what can we do to help? So we were able to divide and conquer. So some of the students are out there doing what you just saw there. Some are in the call center taking phone calls, and I think Amber's been on that. And then we do have some that are actually sewing masks and then going out and delivering them to area facilities like the hospital ERs, the firefighters. We've given a lot of the fire departments masks, and we're still producing the masks. I just got a call the other day that they want us to help with 1,000 masks to go out to the homeless people. just so you know that, girls. So we've been asked to do that as well. And I think it's just teaching them, yeah, you're going to be nervous and you're going to be fearful, but what can we do in a positive fashion to help, to lend a hand? And what better training for them than to be out there side by side with the best of the best, the nurses and the doctors who are out in the front lines.
The best of the best. That's really well said. And again, I can't thank you enough for what you're doing. And I know I speak on behalf of the entire CMU and WCCC community. Be safe out there. Thank you for your service, and we wish you well.
Thank you. You as well.